welcome to The Acorn, the podcast that drops a little bit of psychoeducation so you can gain a better understanding of the therapy world and yourself. So without further ado, let's jump into our episode. Hello and welcome. Our episode today is going to answer the question, what is EMDR? Well, EMDR stands for Eye Movement, Desensitization, and Reprocessing. It was developed by Dr. Francine Shapiro, and it's a therapeutic modality that helps you to heal from traumatic experiences using specific eye movements. In EMDR, there is a clear 8-phase process, including Phase 1, patient history and information gathering, which helps the therapist figure out if EMDR could be a good fit for the client. In Phase 2, it's preparation and education, and that's where the client is resourced with tools to help them self-regulate and better manage their emotions. Phase 3 is assessment, and that's where the therapist identifies themes, specific memories, somatic sensations, negative beliefs, but also positive cognitions the client would like to believe about themselves. Phase 4 is the desensitization and reprocessing phase, where bilateral stimulation, for example, eye movement, butterfly tapping, etc., is used while the client focuses on the target memory they would like to process. Next, we're at Phase 5, and that's the installation, which involves the client getting an opportunity to build and strengthen a positive belief or cognition about themselves. Then there is Phase 6, where they do a body scan. This is where the client gets to check their body for any lingering symptoms from the trauma. And then it's processed. Once their body is symptom-free, the reprocessing is then complete. Phase 7 is known as closure and stabilization, and the emphasis here is on helping the client to get to a place of equilibrium. The therapist uses emotional regulation strategies and also gives clear tips to the client on what to expect and how to stabilize themselves in between sessions. And finally, we're at Phase 8, and that's re-evaluation and further care. And that's where the psychotherapist monitors the client's progress and where the two of them make really clear plans about how to proceed in the future. So what can EMDR actually be used for? Well, eye movement, desensitization, and reprocessing therapy can be used for things like PTSD, betrayal trauma, anxiety, depression, stress, you name it. There are lots of presenting concerns that EMDR can help to address. Now I feel like that was a whole lot of information about EMDR, and that's okay. You can go back over it, you can re-listen to the episode, and I would invite you to even do extra research about it. To me, EMDR is a fascinating therapeutic modality that could be used to support many people. I hope this episode was helpful to you. And now, as we close out this episode, remember to take a moment in your day to remind yourself to pause, breathe, hope, and heal. Take care. Well, this has been another episode of The Acorn. Remember, the content in these podcast episodes are for educational, informational, and entertainment purposes only. Disclaimer. Anything said in this podcast should not be considered as treatment, professional consultation, advice, clinical instruction or assessment, or any other mental health replacement. Listening to this podcast does not create a therapist-client relationship between you and the podcast host. Always seek the advice of your own mental health provider regarding any questions or concerns you may have about your mental health needs. Also, if you need immediate help, contact your mental health provider or call 911. Take care.